Hello, my name is Jacqui Fletcher and I'm the Clinical Lead for Pressure Ulcers for NHS England. And I'm delighted to be supporting this Four Nations approach to raise the profile of pressure ulcer prevention on International Stop the Pressure Day. Pressure ulcers can have a major impact on people and those caring for them. They can be so much more than a sore bottom, sometimes extending deep into the tissues and through to the bone. As well as the pain and suffering for the individual, caring for those who develop pressure ulcers costs the NHS in the region of £531 million per year. Pressure ulcers can happen to anyone, from tiny premature babies to those at the end of life. They occur in both physical and mental health settings and may happen even if a person is otherwise healthy, but has a short period of enforced immobility, such as planned surgery or even an epidural during labour. Although commonly known as bed sores, they can happen at any point on the body when a person is immobile, for example, when seated, including in wheelchairs, and they can also occur under medical devices, such as plaster casts, catheters, or masks and tubing which help breathing, as well as when people become confined to bed. The main way we can reduce this significant harm is to recognise those that are most at risk and put in place appropriate preventative actions. Being able to identify what factors place a person at risk of developing a pressure ulcer is a fundamental part of clinical care. We know that immobility, poor blood supply, poor nutrition, lack of sensation, the use of any medical device that is in contact with the skin, and the presence of a previous or existing pressure ulcer can significantly increase an individual's risk. So these factors need to be assessed for as soon as an individual comes into our care and at regular intervals afterwards, particularly if anything changes, such as their overall condition, circumstances, or the care setting. In fact, for prevention to be effective, every contact counts. Whilst we know there are common risk factors, person-centred risk assessment is key in the prevention of pressure ulcers. A person-centred risk assessment helps the individual and the professional recognise when there is increased risk of developing pressure damage and therefore will inform the development of an individualised care plan.
Hello, my name is Mary Frances McManus, Deputy Chief Nursing Officer for Northern Ireland, and I am delighted to lend my support to this Four Nations approach to Stop the Pressure campaign, which focuses on the importance of how every contact counts in the prevention of pressure ulcers. Every day across the UK, there are millions of day-to-day interactions that organisations and people have with other people. We need to maximise the potential of these opportunities to raise awareness of pressure ulcer risk and initiate preventative action and early intervention to give the best outcome for the people we care for. Understanding how every contact counts maximises the opportunity to deliver safe, high-quality, compassionate care. By initiating a brief or very brief discussion of pressure ulcer risk or prevention to take place can possibly prevent a pressure ulcer occurring. Understanding how to make the most of every contact counts means having the competence and confidence to undertake conversations that demonstrate care, compassion and clinical curiosity. Always listening carefully to better understand and take action to help them and ourselves. The person should always be at the centre of every interaction, affording people dignity, compassion and respect, offering coordinated, personalised care or treatment, supporting people to recognise and develop their own strengths and abilities to enable them to live an independent and fulfilling life. And interactions such as this can take a matter of moments, which can complement existing professional clinical care. Contacts can be very brief interventions, taken as little as 30 seconds to a couple of minutes. They enable the delivery of information to people or signposting them to sources of further help. They may also include other activities such as raising awareness of risk or providing encouragement of support and change. To have the most impact, the interaction should be person-centred. This means being present in the conversation and taking time to fully engage. Decision-making should be shared and most importantly reflect the person's beliefs and values. So we all have a role to make every contact count and prevent pressure ulcers in the future.
Hello, my name is Alex McMahon. I'm the Chief Nursing Officer for Scotland. As the CNO for Scotland, I'm delighted to lend my personal support to this Four Nations approach to Stop the Pressure campaign, which focuses on the importance of how every contact counts in the prevention of pressure ulcers. Our Four Nations campaign this year emphasises on how every contact counts, whether it's every contact with a clinician, a healthcare professional, or a carer, whether or not the contact is with a bed, a chair, or any other surface, every contact with health leaders in healthcare, and every contact on social media or indeed traditional media as well. And if done in the correct way, these can all help to prevent pressure ulcers by delivering personalised, rights-based care embedded within the caring and compassionate professional relationships with individuals and communities. Each contact should focus not only on the person's immediate perceived problems, but also take account of their wider physical, psychological, social, family and community life to make a real and lasting difference to their health and well-being. We are asking for your help to reduce the number and the severity of pressure ulcers that occur. Start with a conversation. Take time to connect, communicate clearly with compassion, and show that you care. Use the opportunity to observe the person in their own environment. Look at their skin, observe how they mobilise, what aids they use, and what options may be available. Be clear about what the expected outcomes are. Notice things that help or hinder them. Identify their needs and ensure that you make the clear notes in the clinical record. Talk to the person, their family and carers. Use the opportunity to teach them what they can do to help themselves. Show them how to test their skin for early damage and discuss the importance of individual tissue tolerance. Assure them that you will consider their needs and wishes, adjust and adapt the plan of care accordingly. Remain clinically curious. Don't just accept the first answer. Find out why did it happen, and why didn't they do things differently. Have the courage to challenge. There's always a reason that a choice is made. Take action, talk to them, maximise the potential for prevention and person-centred care. Thank you.
Hello, my name is Richard Desir. As Nursing Officer for Wales, I am delighted to lend my support to this Four Nations approach to the Stop the Pressure campaign, which focuses on the importance of how every contact counts in the prevention of pressure ulcers. To prevent pressure ulcers in any person at risk, it is essential that every contact is seen as important, every surface in contact with the skin, every individual who engages with people, patients, clinicians, or care providers needs to be considered and meaningful in order to deliver equitable, good quality, person-centered care. The use of active listening and engaging with colleagues and patients to deliver high quality, safe and effective services also contributes to overall improvement in both the outcomes and processes of care, improving the quality of life and making best use of our scarce resources. The knowledge gained from these contacts enables co-production with citizens, healthcare providers, commissioners and other stakeholders to support wider learning, sharing of best practice, innovation and clinical quality improvement in pressure ulcer prevention. To achieve our goal of reducing the harm caused by pressure ulcers, communication is key. This Stop the Pressure Week, we will be offering some fabulous resources to help people use every opportunity to make every contact count. We are working together across the Four Nations to raise awareness of this significant problem and how each and every individual can contribute to a reduction in the burden of pressure ulcers for both individuals and organisations. We have developed a suite of resources that are free to access and download to support creative engagement in education and awareness raising. So please make the best use of these resources. Irrespective of the care environment in which you work, I would remind you of the following. Consider how you can help to identify people who are at risk of pressure ulcers. Offer opportunities to everyone for engagement and learning. Notice early signs of skin damage, irrespective of skin colour or tone. Take the time to be clinically curious. Address any questions or concerns. Concentrate efforts on prevention and timely healing. And take action on what you have found and treating every interaction as meaningful. So remember, when it comes to pressure ulcer prevention, every contact counts.